Good morning, everybody, and thank you so much for being here. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. We are here at Harry S. Truman College, one of the city colleges of Chicago, and this is one of the large vaccinating sites, one of 6 that are open across the city. I'm joined here today by Sean Jackson, the president at Truman College, Alderman James Kappelman from the 46th Ward, Dr. Candace Robinson, the medical director from Chicago Department of Public Health, directing a lot of our immunization work, and then Dr. Geraldine Luna, medical director at the Chicago Department of Public Health, also working on a lot of our vaccine outreach efforts. Also today, after the speaking portion, we will be vaccinating 5 people publicly. I will be receiving my 2nd dose, as will Dr. Robinson. Dr. Luna will be receiving her 1st dose, and we have 2 individuals who will be vaccinated from the community who are healthcare workers. Again, our pods are still vaccinating healthcare workers. We'll be vaccinating Dr. Lori Carrier, the Chief Medical Officer at Heartland Health Center. That is a federally qualified health center, very important medical provider here in the community. And we'll be vaccinating Bertha Moore, a certified medical assistant at Heartland Health Alliance, another uptown organization that does a lot of work, particularly with Chicagoans experiencing mental health or challenges with homelessness. So with that, let me go ahead and get us started. We today will be vaccinating another hundreds of people here at this site, which are among the more than 100,000 vaccinations that have already been administered here in the city of Chicago, and the more than 16 million vaccinations that have been administered across the United States. Our rollout has been going very well here. As you know, we have been focused for the last month predominantly on phase 1A, which means healthcare workers and those who live in healthcare congregate settings, like long-term care facilities, assisted living facilities, and residential behavioral health facilities. Looking ahead to Monday, we will be formally starting to move into phase 1B. And 1B includes Chicagoans over the age of 65, as well as a specific group of frontline essential workers. And I'll talk just very high level about what that means. In this week already, during our transition, while most of our doses have continued to go to healthcare workers, and in fact, we still have many healthcare workers who are right now signing up for vaccine. They've seen their colleagues getting vaccinated and saying, I'm ready to sign up. I want to clarify that phase 1A does not close. Anybody who is eligible, anybody who is a healthcare worker, anybody at a long-term care facility continues to remain eligible for vaccine and will continue to be prioritized within our points of dispensing through pharmacies, etc. Also this week, we did open up that where healthcare providers or hospitals had any vaccine that was not being directed to their healthcare workers or to unaffiliated healthcare workers, they could begin vaccinating some of their highest risk older individuals. So reaching out to people over 65, but especially those over 75 or with underlying conditions. And that will ramp up significantly next week. So first, I want to highlight that every dose of vaccine in phase 1B will be given by appointment. You cannot show up at a pharmacy, at a point of dispensing, at a doctor's office, and think that there is going to be a line for getting vaccine. I know that you've seen pictures of that in other places around the country. That is not how we are organizing our vaccine here. Again, we think a lot about safety as we are also thinking about vaccine. We want to make sure there are doses available for when you have an appointment. We want to make sure we don't have people, especially older people or people who may have other vulnerable conditions, waiting outside in a January, February Chicago. And we really want to make sure that all of the appropriate social distancing, registering, safety procedures related to monitoring are in place. So there will be 4 ways that people will be vaccinated in phase 1B and in fact moving forward. First, most people will be vaccinated through their medical system. So your primary care doctor, your federally qualified health center, your hospital and its system of care will be vaccinating with a major focus on Chicagoans over the age of 65. And in fact, they are already reaching out to some of their most vulnerable patients to make those appointments. Let me highlight that we do not have anywhere near enough vaccine to vaccinate anywhere near the number of people who are going to want to get vaccinated beginning on Monday. I'm thrilled that there is so much demand here. We are not wasting any vaccine. We have not wasted any vaccine in Chicago in 1A. We will not waste any vaccine going forward. But we are receiving just over 34,000 first doses of vaccine next week, split between Pfizer and Moderna. That's the same amount that we received this current week, and it's approximately the same amount going back over the last month. We received between 32 and 34,000 first doses per week. 34,000 may sound like a lot of doses, but we have more than 360,000 Chicagoans over the age of 65. And we have more than 300,000 Chicagoans who are employed in some of the sectors that we also need to push vaccine to in phase 1B. So the amount of vaccine that we are getting each week right now will allow us to vaccinate 5%, 1 in 20 of the people who are eligible. So particularly if you're in your 60s or you don't have a lot of underlying conditions, I want you to understand it is likely to be a number of weeks before you are able to receive vaccine. Similarly, at the city's points of dispensing, we still are working through a lot of the home health aides, a lot of the dental office, the people who provide medical care, especially to vulnerable Chicagoans, and there will be very limited appointments. And in fact, in our pods, I think it's likely to be a couple of weeks, probably into early February, before we have appointments available for seniors. But the good news is that there are thousands of doses going for seniors through medical providers. The second way that people will get vaccinated is through pharmacies. And we have enrolled more than 100 pharmacy locations around the city of Chicago. We will be posting on Monday additional details about how you can look for vaccine availability, look to sign up for doses, again, by appointment. We've worked with all the chains. Things are in place. They are already doing some vaccinating, again, of healthcare workers, but that will be transitioning, and that will be a second way. A third way that people will get vaccinated in phase 1B is through a dedicated vaccination site, like one of these large points of dispensing, but also Chicago Department of Public Health with partners continues to bring vaccine every day to vulnerable settings. We are going in with pharmacies to long-term care. We are bringing vaccine, we will be, into homeless shelters. We'll be looking at other residential congregate settings. Those are not open to the public, but that is also ongoing. And then the fourth way that people will get vaccinated in phase 1B is through their employer. And this is probably what we've been getting the most questions about, so let me put a little more detail onto this. As of Monday, phase 1B is open to everybody who is eligible in that phase. So that includes anybody over 65. It also includes the frontline essential workers that have been prioritized. And to run through that list, I refer you to the website, chicago.gov/COVIDVax, to get more information. But it includes, and I'll just run through, people who work as first responders and in correctional facilities, people who work in grocery stores, daycares, and manufacturing settings that have been hard hit by outbreaks, educators, early education, pre-K, K through 12, and everybody who works in those school settings, and public transit, agricultural, some limited government, and postal office workers. All of those people become eligible on the 25th. So if a teacher or a postal worker or a grocery store worker has an appointment with their doctor, they can get vaccinated. But we will also be directing vaccine through employers to these groups. So to give you a sense of this, we have already set up a point of dispensing that is not open to the general public that is vaccinating Chicago Fire Department, Chicago Police Department. We'll be working through that. We're setting up the possibility for grocery stores, especially where a pharmacy is in the grocery store, to be starting vaccinating the people who work in that setting. We'll be making appointments for daycare workers who are less likely to to work in large settings within some of our pods, for example. And yes, in February, we will be working with our private, parochial, and public schools to bring vaccinations through the employment setting to those schools. So again, teachers are eligible at the beginning of 1B, but we want to make sure that they can access vaccine when there is not going to be enough vaccine for everybody. And so beginning likely mid-February, there will be some dedicated, through the employer, opportunities for educators. We get a lot of questions about why can't we move faster? We can move faster as more vaccine gets here. We have spent the last month not just vaccinating healthcare workers, but building a really significant network of nearly 400, with dozens more being added every day, of places that we can direct vaccine, who in turn vaccinate their communities, vaccinate their patients, and we pair them with where vaccine needs to go. We've worked to make sure that some of our communities that have not seen as high vaccination rates are getting extra attention there, and you'll hear some more detail about that on Monday. But my main word for you is patience. We're excited to see the Biden administration now in place. They have pledged more transparency around vaccine availability. We are hearing that we are not likely to see significant increases in how much vaccine, probably for at least 3 weeks. But knowing that lets us plan more and lets us communicate better with you about why you may not be able to get an appointment that first week, that second week, that third week. But we have plans in place, and we'll be working to make sure that we keep you informed, particularly as the vaccine supply opens up. You do not need to register anywhere as of this minute. If you feel like I've missed a place to register to get vaccine, you have not. The Chai COVID Coach, which is the top link that you'll find if you go to the vaccine website, is the place that you can register if you want to make sure that you're getting the up-to-the-minute updates about how you can get vaccine. And then on Monday, as we move into Phase 1B, there will be more information shared about the possibility for doing some more centralized registering. But again, most people will get vaccine through their providers, and we are prioritizing those at highest risk. It's an exciting moment. I'm thrilled that we are able to be pushing vaccine in a way that brings our COVID numbers down. Partly it's about getting vaccine into arms, but it's also recognizing that where we can direct vaccine to some of these employment settings where we've seen so many people get sick, and we've seen those people then bring it to some of the communities that have been hardest hit. Getting vaccine into those communities and those workplaces helps us decrease the risk of COVID for everybody. We're seeing excellent progress with COVID numbers here in Chicago. Our rates are down, our positivity is coming down. We're looking ahead to potentially, hopefully very soon, being in a place to start some careful reopening of restaurant dining, and I know how much interest there is in that. That's because we are broadly bringing COVID under control. And the work that we're doing through vaccine is to make sure that the vaccine is one more tool in bringing our city post-COVID. So I ask, if you're feeling frustrated, and I know a lot of you are going to feel frustrated, 360,000 people over the age of 65 wanting vaccine, not enough vaccine. I urge patience, and to think that where we are directing vaccine, it's going to the places that will decrease your risk as a Chicagoan, and we will not waste vaccine. We will work very hard to ensure that all doses are being used in partnership with providers, pharmacies, and employers. And with that, I'm very pleased to bring up Sean Jackson, the president of Truman College and our host here at the pod, and thank him and really City Colleges of Chicago for the amazing partnership that they've shown in supporting a lot of the most important operations here in Chicago.
Thank you, Dr. Already. Thank you for your leadership throughout this crisis. On behalf of Chancellor Salgado, City Colleges of Chicago, is committed to supporting our city's response to the pandemic in any way we can. Truman College, where I serve as president, is proud to join Malcolm X, Daley College, Arturo Velasquez, Kennedy King College, and Olive Harvey College as Chicago vaccination sites. I want to take this opportunity to thank all of those who have been involved in the fight against this virus, including the healthcare workers and other essential workers. Together, we have taken on this city. Thanks to everyone for doing their part. Now I would like to ask Truman's Alderman, Alderman James Kappelman, to say a few words.
Thank you so much, Dr. Jackson. Truman College is a beacon in this community. A beacon because they've opened their doors and to search for ways that they can include all of us. Because Uptown is a community that is a community of immigrants. We have over 92 different languages spoken in the Uptown community. And many of the immigrants, when they come here to Truman to learn English and also to get more education to help them support their families. So Truman College is, I can't speak highly enough about them. Many of those immigrants that come here, and first-generation immigrants, they take courses here and they take courses in health where they become home health aides or they become nurses. And many of these immigrants are taking advantage of the COVID vaccine. They understand that science is real. We haven't heard that in a while, but science is real. And it's more important than ever that we all get this vaccine. I remember hearing that, you know, our providers will be contacting us, and I was anxious about that myself because I want this COVID vaccine. I'm in that 1B category. I'm 68 years of age. And last night, my medical provider alerted me on my app that I can now register to get the COVID vaccine. So I quickly registered, and I will be getting that COVID vaccine. I cannot wait. And it's important that we continue to get the word out. There is still fear about this vaccine, but Dr. Auerty can attest this particular, all these different vaccines that are coming out, there's been no shortcut in the testing. We know it works. It's been a fast route, amazingly fast, but science has been able to do that. This almost reminds me of what I went through as a little kid, and I don't see many people my age, I'm feeling old, lining up to get the polio vaccine. My mother had polio, and so getting that polio vaccine was very important, getting the word out. The same is true now, more than ever, because this really does save lives. So at this point in time, I would now like to introduce Dr. Candace Robinson.
Good morning, everyone. I just wanted to take this opportunity to highlight the importance of getting the second dose of COVID-19 vaccine. You really need both doses of the vaccine for the vaccine to be most effective and to provide the most protection that vaccine can provide. For example, in the Pfizer trials, the vaccine was about 52% effective after the first dose of vaccine, compared to 95% effective after both doses were administered. Now, between the two vaccines, it's also important to remember that you should get the same vaccine that you got for the first dose as the second dose. So if you received Pfizer for the first dose of vaccine, you should receive Pfizer for the second dose of vaccine. If you received Moderna for the first dose of vaccine, you should receive Moderna for the second dose of vaccine. For the Pfizer vaccine, the two doses are separated by 3 weeks or 21 days. And for the Moderna vaccine, the two doses are separated by 4 weeks or 28 days. I also want to take this opportunity to just talk a little bit more about safety. Safety remains a top priority with regard to this vaccine. And there are safety monitoring systems in place for those who receive the vaccine. One of them you may have heard of or may not have heard of yet, and that's the vSafe program through CDC. And so after you get your vaccine, your provider has a barcode that you can scan, and on your smartphone, they check in with you to see, ask about any side effects or anything that you've had. After my first dose, I got those texts myself, completed the survey every day, and for about a week, and then they space it out a little bit more. Another thing you'll be asked to do is when you come to a vaccination site, it'll be really important to be observed following the vaccine period after you get your vaccine. And so you'll be asked to wait 15 or 30 minutes, just depending upon your individual history, after vaccination. Now, some of the common side effects after the vaccine are arm pain, swelling or redness, and also there could be some other side effects. Some people have had fevers, chills, but it's important to note that these side effects are mild and generally pass on their own. I myself had a little bit of swelling and sore arm after my first vaccine, but I accepted that for the protection that I receive against COVID, and so that was important. Additional communication resources that we have and additional information about safety if persons want to look on our website, you can go to chicago.gov/COVID-vax. And there we have information about safety, about the effectiveness of the vaccine, frequently asked questions, and other information will be forthcoming, as Dr. Arwady mentioned, regarding Phase 1B and vaccination. I think it's important to re-highlight what Dr. Arwady said. We just don't have enough vaccine for everybody who wants it at the beginning of Phase 1B, but we are working very hard to continue to bring providers on board and to direct vaccine into the community so that we can get persons vaccinated as quickly as we can. And with that, I will turn this presentation over to Dr. Geraldine Luna.
Buenos días a todos y feliz año nuevo. Soy la doctora Geraldine Luna, directora médica del Departamento de Salud Pública de Chicago. El objetivo de nuestra actividad hoy es vacunar a la mayor cantidad posible de personas. Cualquiera que no haya sido o haya recibido su vacuna, pero que esté dentro de la fase 1A, sigue siendo elegible. Su vuelo sigue abordando, pero no ha despegado. Así que está a tiempo. Recuerde, no estará completamente protegido hasta que reciba las 2 dosis de la vacuna que se requiere. La seguridad de nuestros residentes depende de la vacunación contra el COVID-19 para restaurar nuestra salud y volver a la normalidad. Asegurar la eficiencia de este proceso es nuestra máxima prioridad. El 18 de enero se pidió a las organizaciones de la salud y nuestras farmacias intercalar las fases 1A y 1B, que ahora incluyen trabajadores de la primera línea o esenciales y adultos de 65 años o más. Esa es una gran ocasión que tenemos que celebrar. A partir del lunes 25 de enero, Chicago pasará formalmente a la fase de vacunación 1B. Eso incluye todos esos empleados que están el día al día enfrente de sus trabajos, que no pueden trabajar desde sus casas. Debido a la disponibilidad limitada de vacunas, estamos siguiendo las recomendaciones de nuestras academias nacionales para la priorización basada en los factores de riesgos. Los trabajadores esenciales son el cordón espinal de la economía de nuestra nación y están sobrerepresentados por nuestras comunidades de color y nuestras comunidades más vulnerables, nuestros indocumentados y aquellos que no tienen aseguranza. Esencial significa que no pueden abandonar su puesto, que a diferencia de muchos de nosotros no pueden trabajar remotamente. Necesitan estar allí. Por la naturaleza de estos empleos, nuestros trabajadores esenciales están más expuestos a contagios del COVID-19, por ende han sufrido desproporcionalmente los estragos y la devastación de esta enfermedad. Por ello es que urgimos a nuestros trabajadores esenciales a tomar parte en la vacunación cuando sea su turno, y su turno es ahora. De igual manera, exhortamos a nuestros residentes de 65 años o más a vacunarse por la edad y factores de riesgos, como enfermedades subyacentes. Este grupo está a más alto riesgo de contagios y de morir a consecuencia del COVID-19. Recibir la vacuna es la mejor manera de protegerse a sí mismo, a su familia y a su comunidad. Las vacunas salvan vidas. En la fase 1B no habrá suficientes vacunas para todos de inmediato, como ya explicó nuestra comisionada de la salud. Sin embargo, para asegurar que los esfuerzos sean coordinados y efectivos, queremos pedir a todos nuestros proveedores de la salud médica que se asocien al Departamento de Salud Pública de Chicago para hacer llegar las vacunas a los residentes de Chicago con mayor necesidad. La equidad continúa impulsando nuestros esfuerzos de implementación. Estamos trabajando para garantizar que las vacunas se administren primero a las personas con mayor riesgo en las comunidades más afectadas. Hoy yo recibo mi vacuna. Mi vacuna es segura, nuestra vacuna es segura y es la única manera de acabar la pandemia y con la devastación que esta enfermedad ha tenido con nuestras comunidades de colores, como también ha afectado a otros, pero particularmente a nuestras comunidades. Gracias.
All right, thank you. I'm happy to take questions or direct them to anybody up here.
This is Jesse with Univision. I'll start with a couple of questions from our station. What would people in the 1B group need in order for them to be able to register?
So for people to be able to register, first, as a reminder, most people are going to be vaccinated through their healthcare provider. So if people have a regular healthcare provider, a federally qualified health center, a hospital, etc., they will be reaching out to you, but also that is a right place to start because we are enrolling dozens of more providers every day. In terms of being able to be eligible, if the question is more when there become appointments at some of these more centralized locations, we will not be providing proof of a particular type of employment because, again, we will be bringing we will be bringing vaccine to employers, and in the case of daycares, for example, there's a system where we work through employers to get people registered. So we will be looking, at people's date of birth and making sure that people who are getting vaccinated are over the age of 65, but there is not, I think the question may be, do I need to have a particular piece of identification? You do not. Do I need to have a particular proof of a type of employment? You do not. We will be really opening to people based primarily on age and then through employers.
If we may, any comments on the reopening of CPS? CTU states there is about 50 schools with COVID-19 cases. Is this worrisome since there is only a few students in the buildings?
So what I can say at this point, and I know there actually is a dedicated conversation about this later where we'll share some more details, is that we've not seen cases in CPS out of range of what we've seen in the community broadly. I remain very confident in the protocols that are in place, and we will be sharing in conjunction with CPS some more about how the reopening has been going, as well as some more information about vaccine planning, which of course is the primary thing that we are focused on, making sure that the school is safe and that we've got a very good plan in place to ensure that we can bring vaccine into these settings. But I want to emphasize it will take many, many weeks to get everybody vaccinated in these settings, again, because of the amount of vaccine that we're receiving.
Thank you. Question from CBS. Can you please give us a breakdown by race and ethnicity of how many Chicagoans have received doses so far, and how does the location of these sites help to increase the equitable distribution of the vaccine?
So If people have been following along, really every day we've been posting additional data sets and information. You can look by geography, you can look by age. We have not yet been able to post race ethnicity data, but that is actually because of some technical challenges that remain. Obviously, race ethnicity is one of the things that we are the most interested in, and just to give a little bit of context for that, what we have found is that even where the people who are vaccinating, like the healthcare providers, the hospitals, are appropriately asking about race ethnicity as is required in the city of Chicago, and they're entering that into the computer system. In a lot of cases, when the computer system is then talking to the state registry where we keep track of vaccines so we know when people need second doses, 85% of the time, that ethnicity data in particular is not being transmitted. So the team has been working on the tech behind the scenes, but we felt so strongly that we had to be able to answer this, that there's also been work with something called imputation, which we worked through DePaul University. We've been doing it over the summer, where race and ethnicity is missing. We're able to use a scientific way to basically do some prediction of that. And we will be sharing that data on Monday, in fact, in conjunction with more of the conversation about how equity, which is central to this plan, fits into the details.
This is a question from Block Club Chicago. We are hearing from many readers that they're confused and anxious about how to sign up to get vaccinated. Why hasn't the city created a form where people can sign up to get vaccinated? Why is it relying on people finding their own information and vaccine providers instead of providing them to them?
All right. Anybody who feels like they want to register right now to make sure they are getting the most up-to-date information, I point you to Chai COVID Coach. That is the place where we are communicating out. There is, in fact, a central way for people to be able to register for some of these vaccines, but again, all of our central appointments right now are being used by these 1A healthcare workers. And where we continue, like today, for example, we're vaccinating folks from Heartland Health and Heartland Alliance. These are still filled by 1A folks. We are working, and again, we'll be sharing as we formally move into 1B on Monday what some of that more centralized site is, and there will be some very limited appointments that will be available, but most people will be getting vaccine through their provider or through their pharmacy. So Chai COVID Coach, if people are feeling very concerned about wanting to make sure that they're up to date, as we formally move into 1B, we'll be sharing more about the centralized system, but great majority of people will get vaccine outside that centralized system. Pharmacies, in addition, we will be sharing the information about where people will be able to register for appointments there.
This question is also from Block Club. We are hearing from people not in phases 1A or 1B who have been able to get vaccinated at local healthcare clinics and pharmacies. Doesn't this take up slots from people who need it more? How is Chicago combating this to ensure its campaign is equitable?
So what I can say to that is that without knowing the particulars of the situation, I don't have a chance to follow up on it. The huge majority of vaccine has been administered to the folks for whom it is appropriate. I would say that the examples of a few cases where I've heard is in some cases, again, where the technology is being developed. One of our pharmacy partners, for example, as they were working to make sure they would have the tech in place for as we open to 1B, there were some people who managed to get in there and sort of get some appointments before it was formally open, and they then were able to close this. We're not trying to stop people from getting vaccine, but again, just making sure that opportunities are available at the time that is right. We also want to absolutely ensure that no dose of vaccine is wasted. And let me just underscore that. No vaccine has been wasted in the city of Chicago. No vaccine will be wasted in the city of Chicago. When we open a dose of a vial of vaccine, Pfizer, for example, there are 5 doses in there. So we have worked and asked our partners to make sure as you're opening that vial, who are those 5 people getting vaccinated? Who's on your backup list in case somebody doesn't show? But if you get to the end of the day, we want them to have a plan to make sure that, that they're vaccinated. For example, here at our city pods, we first vaccinate everybody who is registered for an appointment that day. We always have a few people who don't show up, but we have the people who are working in the pod, the doctors, the nurses, the people who are doing the registration, who then are able to fill in to ensure that all of those doses are in place. So I could imagine a situation where perhaps if that planning had not totally been in place, you might have had 1, 2, 3 doses that you wanted to make sure were being used. We want to make sure no vaccine is wasted. But this is not a large-scale problem. No vaccine has been thrown away. No vaccine has been sent back. There's a lot of, I think, misunderstanding about that. And particularly as we move into 1B with more than 600,000 people eligible, I do not anticipate it being any issue identifying people who are appropriate for vaccine.
Our colleagues from ABC would like to know about indoor dining. Are health officials going to allow it this weekend? If not, how soon?
Sure. So right now, the city of Chicago, just like other regions around the state, are under mitigation at the state level. And what you've been hearing probably is that over the last week or so, because not just Chicago, but Illinois has made really good progress against COVID, under that state mitigation, we've been able to do some reopening. So we announced, earlier in the week, the museums, very limited capacity, able to reopen. The fitness centers, with that 10-person class limit, being able to move into a space where very small gatherings, the 10 people limit are allowed. If people have questions about that, I would refer to chicago.gov/reopening, and you can always get there after off the coronavirus site. So right now, Chicago is in this Tier 2 state mitigation, and the question is, when do we move to Tier 1? To move to Tier 1, we, like every single region around the state, needs to have adequate ICU capacity, which we have. We need to have declining numbers of COVID patients in the hospitals, which we clearly have. We're doing very well. And we need to have a sustained positivity rate under 8%. I can tell you that, that we're right around that 8% mark, and we've been there for the last couple of days in the way that the state is measuring it. Today, yesterday, the day before, we were right at 8%. Everything's moving the right way, so I anticipate that in the next day or two, we may start to be below that mark. You've got to be below it for at least 3 days. So I don't have a magic ball. It's all about, as always, we continue to follow the metrics. And we've been making good progress. I want to thank everybody who's been doing a good job. Like Chicago and Illinois are doing so much better than most of the country in terms of coming out of this surge, and we're getting there. When we are able to move ahead with that reopening, it will also be very careful. We'll start with 25% capacity, maximum of 4 at a table. We're going to do this carefully, but as you've heard the mayor say, we really want to make sure that this is something we're able to do just as soon as we can hit those metrics and feel confident that it's safe. So I don't have a date on it, but as I said earlier, the way things are going, I think it may be able to happen within a week.
Thank you. From the Chicago Sun-Times, the West Side and South Side Chicago zip codes with the highest number of COVID cases and deaths still appear to be among those with the lowest numbers of vaccinations. Can you elaborate on how you're addressing these going forward?
So on Monday, when we formally start 1B, we and the mayor will be sharing a lot more detail about that planning. But let me put just a little point on it, which is that in Phase 1A, all of our vaccination has really been based on employment. So we have been able to vaccinate people who are healthcare workers and people who live or work in these congregate settings. As we move into 1B, this is really our opportunity to broaden our availability to direct vaccine, to work on vaccine uptake. And so we have very specific plans around really making sure that we're doing everything we can to lower any barriers to vaccine, and you'll hear more about that, and to make sure that really all of Chicago is getting access to this vaccine. Part of the reason that that map looks the way it does is in terms of who's raised their hand first, but part of it has to do with who works in our healthcare systems and in our hospitals. One of the reasons I emphasized that you don't lose your spot just because we're moving on to 1B if you were eligible in 1A, is that I really want to say to healthcare workers, like, the plane is still boarding. You haven't missed your opportunity. Get on board now, because getting healthcare workers vaccinated is one of the most important things in terms of then building that confidence with their patients, making sure that we have safe and protected healthcare environments. So we have a lot of work happening, and in fact, the provider outreach, you heard me say we've gotten hundreds and hundreds of folks enrolled. We've been focusing especially on making sure in some of the areas where we have not seen as much vaccine uptake to date, that those providers are being supported. But we're doing it across the city. It's not that we're only doing it in those areas. And more to come on Monday.
Thank you. This is from Bloomberg. I believe you talked a little bit about this issue, but it says some cities are reporting shortages of vaccine doses. Is Chicago experiencing any of these? So
what I would say is that we have built a system that can handle 5 times the amount of vaccine that we are receiving, should we be able to receive it. The reason people are concerned is that I think there was a lot of conversation at the federal level about an expectation that vaccine would ramp up very quickly. And unfortunately, it just has not. With the new administration in, one of the things that they have pledged is that they are moving a lot of resources into production and invoking acts to really do everything we can to increase production of the vaccines that are already proven to be safe and effective. And remember, there are other vaccines that are coming along behind that are finishing trials. We can't speed that part up. We've got to make sure every vaccine that is available has all of the appropriate safety and efficacy work done on it. But I expect, over these next few months, the production and our availability to ramp up. So yes, I wish we were getting, instead of 34,000 doses, I wish we were getting 100,000 doses, 150,000 doses even, because there are so many people who want this vaccine and who will be eligible starting Monday. So the whole country is anxious for vaccine, and we've worked hard to build a system here that can handle just as much vaccine as we're able to receive.
From the Hyde Park Herald, can you ask for a response to the CDC's report last Friday on the projection that the B.1.1.7 variant will likely be the predominant strain in the United States by March?
Sure. So in case everyone doesn't know the context there, so this is about one of the newer variants that has emerged. It's the one that's sometimes called the UK variant, and we do have the capacity to test for it. It's a special kind of testing to look for variants, and it was detected for the first time here in Chicago last week in a traveler to the UK, but it's been detected in I think about 20 states and at least that many countries around the world. It is very much here. And the concern is that because this variant is a little bit more, or maybe more than a little bit more, we're still learning, infectious, meaning it can spread more easily. By definition, if it is the one that can spread more easily, it will spread more than the other variants that are here. The good news is that the way that we protect ourselves against this variant is the same way that we protect ourselves against all of the other variants. Masks continue to work, social distancing continues to work, the vaccine continues to work, very importantly, and the variant does not make people sicker. But part of the reason why when in our vaccine planning here, it's not just about, can I get the people who are willing to stand in line, for 24 hours to get a vaccine, but working to make sure that we're getting vaccine into the sites that are most driving our outbreak here in Chicago, is that it is imperative that as a city, we decrease opportunities for spread, because every time it spreads, that's when the virus has a chance to mutate, and that's when you have the chance for this new variant to really get in. So we are focused on vaccine, obviously, but getting vaccine to factory settings that have seen outbreaks, or some of these community areas that have been hardest hit, our long-term cares, into the jail, that is as much about protecting Chicago from the variant and whatever may come as it is about the vaccine itself. So I'm confident that the things we have in place are strong here. Ask people to keep doing the things that they have been doing, and then get your vaccine when you have your chance, and recognize that some of the reason we are doing some of this prioritization across the city is to decrease the chances of COVID for everybody.
One more question.
Yeah.
When will individual GPs be notified as how to sign up their patients over 65?
So individual GPs already may register for vaccine. We sent a letter to every physician who is licensed or has an address in the city of Chicago. But if people didn't have that letter, it's the same place. If you go to this chicago.gov/vaccine, that website, there's a whole section for healthcare providers. It brings them to, we've got a lot of details for healthcare providers. They basically need to fill out paperwork first and foremost. You have to make some agreements about how you'll use this vaccine. You have to have some particular storage and training in place. You have to make sure that you're registered and know how to report into the state's registry. But that is what we've got folks at CDPH reaching out to help people to do. But if there are providers that are, have questions about that, please start at the website. And we've got a lot of people at CDPH dedicated to make that happen. Again, our goal is to be able to get vaccine so that your COVID vaccine, so that the way you would get a flu shot, the way you would get a tetanus shot, the way that your children would get vaccines, that's the system in which we most want people to be able to get a COVID vaccine. So I'd refer people to the website, and there's a lot of detailed information for healthcare providers, both if there are still any unaffiliated healthcare providers who have not been vaccinated themselves and have changed their mind, but also for getting registered. Thank you. Moving over, and if you would like to do some recording of the vaccine process, we're happy to facilitate that. Thank you.